The following portion of Living Local DMV is sponsored by Capital Caring Health. Welcome back. Dedicated to providing free hospice care to the DMV, Capital Caring Health continues to support families in some of life's hardest moments. Here to share more on the support and care they're providing is Chief of Communications and Philanthropy and also friend of the show, Steve Cohn.
Cherise, always a pleasure. Thank you.
Well, we talked about it a lot here on this show, is how hospice care is so important to families, and people don't even know they have access to it. Tell us more about what Capital Caring offers to people if they don't know.
And we've been doing it for almost 50 years. So at the end of life, you really have two choices. Hospice care, which is comprehensive and holistic for not only the patient, but to help the family as well, versus the only other alternative is repeated hospitalizations, often dying alone in an ICU, and patients almost always have more precious moments and live longer in hospice care for two major reasons. One, we're providing the care at home most of the time, so they feel mentally much more comfortable. And two, they're not being literally medicated to death, which unfortunately at some point chemotherapy and other medications are counterproductive in the last few months of life. So it's really a fantastic benefit, and it's free. And many families get hit with major medical bills at the end of life if it's hospitalization that they go toward. So really want to tell people about all the time that hospice care almost always is such a better alternative for the family, the patient, and even the government. So with out-of-control healthcare costs, partly because of the aging of the baby boomers, Medicare and Medicaid are under a lot of pressure since their spiraling costs keep going up and up and up. But if you choose hospice care versus hospitalization, not only is the patient and family better off, but Medicare and Medicaid can save billions and billions of dollars a year because hospice care is much more cost effective than repeated hospitalizations.
So what I'm hearing, Steve, is that there's nothing but pros here for hospice care. And what I like to talk about on the show a lot of times is that women lie, men lie, numbers don't. So let's talk about the statistics of someone who is in repeated hospitalization, and also of the emotional impact of being in a hospital versus being in under hospice care at home, or also your beautiful facility at Sibley.
Right. So it really boils down to the government pays hospice organizations $280 a day for in-home care, versus hospitalization can run thousands, tens of thousands, hundreds of thousands of dollars in the last few months of life, versus the per diem that we get from the government. And it's a win-win-win for everybody. And when a patient needs inpatient care, like at our Sibley Center, thanks to the generous support of the Washington Home Foundation, we get paid $1,000 a day for two nurses covering several patients around the clock. So you can't even get that kind of care in a hospital. Yet it's so much more cost effective for all of us taxpayers, and so much more beneficial for the patient and the family, and the patient almost always has a longer period of life, weeks, months. We often talk about
years.
Jimmy Carter. We talk about him and his 2 years in hospice care. Versus if he had been in a hospital, he probably would have died the next week.
Well, you talk about benefits. Let's also talk about the benefits to the family, because you also offer counseling. Let's talk about that quickly. Right.
When the patient passes, we provide free bereavement counseling for as long as necessary. With all family members. We even have folks specially trained to care to provide grief counseling for children. Our volunteers help us with all of these activities. And we also provide free bereavement counseling for any member of the community, anyone living in the DMV. They don't have to have a patient relationship with us. We view that as our mission, to provide free grief counseling if you've lost a loved one, a close friend. And for children, I often hear that children don't ever get any counseling because people focus on the parents when a sibling dies. We provide counseling for the children as well, with specially trained counselors.
Absolutely amazing. And I say you guys put the caring and Capital Caring Health. Can we quickly, before we wrap up, talk about
Well, spring is coming, even though it's freezing out today. So I like to introduce our two robotic birds.
I love it.
A bluebird and a cardinal.
I love it. You bring in more care and more springtime.
Our patients love these. We all love these.
I love them. Well, Steve, we love you. Before we go, just give us the website.
Yes. To learn more about everything we can provide to you and your family, go to capitalcaring.org.
I love it. I love it. Well, Steve, thank you for everything you do. It's so great to have you here. And thanks to our friends, our new friends on the show. Thank you again. The preceding portion of Living Local DMV is sponsored by Capital Caring Health.